Health experts around the world are warning about a potential twindemic this fall and winter. It's a scenario where a surge in COVID infections coincides with the severe flu season, putting more pressure on the healthcare system. Provincial Health Officer Dr. Bonnie Henry says this year's flu season could start early and says get your flu shot as soon as it's ready.
We've started to receive vaccines and we'll be moving them out to people in the community, and it'll be available in all of our pharmacies and community clinics by October 11th.
Henry says a more severe season in Australia and New Zealand shows what BC needs to be prepared for. The province has seen very little to almost no influenza the last few years. She says people should also receive an invitation for a bivalent booster shot targeting the Omicron variant in the next few weeks.
We have a high level now of protection, but that protection may fade over time, and we have things that we can do to stop that from happening. And that means getting vaccinated, boosting up that protection again over the next few months.
There are also concerns waning immunity in November and December will lead to more COVID infections. The province is boosting surveillance by increasing its wastewater monitoring, which officials say accurately reflects how the COVID infection is faring. Health Minister Adrian Dix says a plan is in place to free up 1,500 hospital beds by moving some patients into community care. Currently, there's an average of 350 hospitalizations, expected to go up significantly this fall.
That means, on top of the 350 we have now, there's an expectation we might get to 700, and that is a significant number of patients.
He says influenza this season suggests a peak of 1,200 hospitalizations, which could happen earlier than previous flu seasons in mid-November or December. Health officials say a last resort tactic would be to postpone non-urgent surgeries, something not seen since the peak of COVID infections. Mira Baines, CBC News, Vancouver.